Okay, it's downloaded.
Okay, did you register yet?
I have I'm registered neurosurgery. I'm doing the register.
Okay.
Surgery, okay, language, Spanish. For how long did you study here in Guadalajara?
2 years. And then I was able to transfer. I did well on the boards and transferred to Philadelphia. But you know what? It really didn't matter because people told me that, oh, you know, you got to graduate from American school. That's not true. As long as you graduate from an accredited school anywhere in the world and you come to the United States, people don't even know where you went to school. They don't care as long as you get the, you know, basic requirements. But it's something I had in my head as an American. I was inferior because I had to go overseas. And, you know, it took me a while to get over that inferiority complex. It doesn't really matter. I've seen great doctors from all parts of the world. I've seen terrible doctors in the United States. So, you know, yes.
Forward social media, I mean, Twitter.
Okay.
Oh, I see. I need to put an image. For a good picture of my.
You doing okay with that app?
Yeah, it's.
Did it open yet?
Yeah, I mean, I just put in my profile picture.
You might have to reboot it.
Thank you for registering with Neurocircle TV. We're receiving your profile data and will respond via email soon. Oh, let me open the email. Where is it? I'm just waiting the email confirmation from the app.
Oh, you gotta kind of have to confirm your registration.
Yeah.
Oh, okay.
But I'm waiting.
Oh, okay.
Well,
you can do it later. It doesn't matter. But
yeah,
anyways, when you open that app, like once you go to this, it comes right on the front page. When you open the app, there it is. It's there. So it's going to be, hopefully it'll be easy for people to access are talks, live talks. Just tap
Oh,
the app once to open and once to open the video, 3 times. You go tap, 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 and you're in. Because it's important to tap and not type. You know, typing is a pain in the neck, as you know, on the smartphone.
okay. So I just need to open it 3 times. I get it
Yeah,
right?
just follow it. Just, did you open the app?
Well, let me see. I mean,
Yeah,
let me
just,
try to enter without
no,
receiving the.
reboot it, reboot your smartphone. And your icon of neurosurgical should be on your smartphone, right? Because you've registered and everything. It's downloaded.
Yeah.
It's on there. So why don't you reboot your smartphone
Okay. Okay.
and then open the app.
Okay. Yeah.
Okay, you see the video there? There you go. Yeah, there you go. You got it. That's it. That's the video we're making right now. It's a couple of second delay because of, you know, Facebook and YouTube. But that's our video live right now. So you understand that, right?
Yes.
Yeah, that's your live right now on the smartphone throughout the world on the internet, but it's publicly available. In other words, you have your own TV station. I made my own TV station.
Fantastic.
Very little cost. In the old days, you need cables and trucks and cameras. Now you just need a desktop with a camera, and you need bandwidth. But I mean, you can set up your own camera of your station for anything you want.
Well, you told me something really interesting to explore, you know, because
Yeah, you can do this to teach, man.
I mean, I get a lot of surgeries that went well. I mean, I love to operate pituitary adenomas to the nose with endoscopic. I've done
No, I'm sorry. What do you like to do again? What
adenomas to the nose endoscopically.
Oh, okay, endoscopic. Okay, yeah.
I've done cavernous sinus surgery, actually. Let me show you one case.
Yeah, you can do your own presentations. You can do one Sunday if you want.
Oh,
We may do a grand rounds in Spanish in Latin America on Sunday.
yeah, I mean, I know that I'm not being controlling, but
Oh, no, but we have we've had a lot of Spanish webcasts from all types of neurosurgeons.
I've seen from South America, right?
Yeah, we do from a lot. Oh man, you know, I have a channel, Neurocytohia TV, but I don't really use it that much now, but we want to restart it.
I'm looking for the case that I was telling you about. Pláticas, caso multidisciplinario, deep space. Maybe I put it in the cavernous sinus. But anyway, I was telling you that I know Professor Pinko Darling from Little Rock a long time ago.
Yeah, there was Christian. Who else has been there?
I'm sorry?
There's a couple of other big people there at Chris's place, right?
Oh yeah, I mean, I met Professor Yu Ernestnemi there. Uh, Professor de Oliveira when he was okay.
Okay. Oh, yeah, yeah.
He's been
What's his
sick.
name again? The
Evandro.
all, yeah, yeah, Vandro. Yeah. What's his health problem? He's had a stroke or?
Uh, no, no, it was mm, Ella.
Oh, yeah, Lou Gehrig's disease. Lou Gehrig's
Exactly,
disease.
exactly, exactly, exactly.
ALA.
Yeah,
Amylopic lateral sclerosis.
exactly.
Yeah, Lou
Yeah.
Gehrig's disease. Lou
Look
Gehrig
at-
disease.
Yeah, it was
He
very
was a baseball player that had it in America.
exactly, exactly. I mean, it was named after him, and unfortunately, the last thing that I knew from Dr. Chris in one of their webinars that it was now just able to move their eyes to communicate.
Oh, really? So he's severely
Yeah,
affected.
it's a sad thing to know.
Yeah, I knew he was very ill because he certainly wasn't appearing at conferences and he was just being talked about. And I thought, wow, it must be pretty severe if he can't, come on the screen. He must be really sick. So, okay. Okay, well, yeah, they certainly hold him in reverence, reverence when they speak of him.
Yes.
So,
Yeah, it's a
yeah, we
sad.
broadcast Dr. Herrera a lot and Borba. Borba's starting a series. Let me show you for another biggie that I'm sure you know, Al Mefti.
Mhm.
Let me see here, Al Mefti. Yeah, there it is. Okay. You see, you know him, right? Al Mefti. I guess he's a big
Yeah,
skull-based guy.
yeah, it's
Yeah,
very famous.
Borba came right to me and says, John, will you televise this webinar series? It's going to be 2 a week. And those guys really know how to do a conference. Borba's Brazil Society, those
Mhm.
guys are good because what they do is they kind of limit it just to neurosurgeons on the panel, which I don't normally do. But he has like 5 or 6, really good neurosurgeons that are good on it. I mean, and they take a topic and they really go through it. I mean, it's great. I mean, you can imagine whenever you get that many neurosurgeons together, it's good to hear different stuff. It's good to hear, and he does it. And I believe Al Mefti is going to lecture in a couple of them, but it's basically a series modeled around his fellows and his school of thought and stuff like that. It's going to run, I think, for like a couple of months on Thursdays, I think. But so Borba's very active. He loves this medium. He's a great teacher.
Yeah, he was born for that. He
Have you
loves.
seen him? Have you seen him teach? He's
Of
great.
course.
Well, let me tell you a little secret, not a secret, but I've been doing this for a while, and I televised him in Russia because Alfred Sufinov, his name is pretty big in endoscopy. Do you know Sufinov from Russia? Alfred Sufinov. Well, he's
I've
at a
heard of him.
okay. He's at a place in Siberia actually. It's called Tyumen. It's out in the middle of nowhere, but he's there with a good crew, and they have a big neurosurgery center. But anyways, Borba went there. He was funny because he really wants to teach, and the residents were there. They want to sleep. They're tired. He wouldn't let them sleep. He says, "Come on, you guys, wake up, ask me questions." He was funny about it though. He knows what it's like to be a resident. You're tired as hell. And you sit down at those conferences, sometimes you doze off. But he would wake
Yeah,
them up. He would wake them up. It was funny.
they need to learn, of course.
Yeah, but he's a great teacher too.
Yeah, I mean it's kind of funny too.
Yeah,
He
very
cannot stay restless for a second. You know, it
well.
was
You know what he does the way because I watch them obviously when I'm televising them. I don't understand a lot of it, but I can tell the tempo and the way he involves everybody, and he'll say, "Oh, hey Jose from Costa Rica, you've done these cases and this and that." It's not like someone like me that doesn't know how to maintain the flow, amongst neurosurgeons. He knows the basic neurosurgery and who would be the right person to involve in the discussion, which is very good. It's very good. That's a good moderator. It advances the science. If you have someone that really knows how to moderate, it advances the discussion. Sometimes it can fall flat, without someone like Borba, and just be very mechanical and regurgitation of facts from this person, that person, and not really kind of mixing the ideas and getting it going, getting the thinking going. But yeah, that's the beauty of this platform. It gets people together and you can really mix thoughts even more than a conference, because at a conference in person, you may be discussing something with a couple of neurosurgeons after, but you got to
exactly.
run, you got to go and you got to get coffee, you got to, next conference starts and, but this platform, you can let the people go. And sometimes I do. They ask me, is there a time limit? No, I said, no, keep going, keep going. So which you don't have that luxury in an in-person conference, whereas online you do. You have more, you can do what you want pretty well, which is great. So okay, great. So yeah, if you can get anytime, just let me know. Say, John, I got a laptop. Let's test it, because this is new to me too. I'm learning, but I'm pretty sure this is the way it's done and it's going to work, I think. So, okay, are you working today or no? You have day off?
Me, I'm working, but I have a time. I'm at the hospital, but like everybody here is working on COVID, and
Oh, so you're treating COVID patients?
no, fortunately, no.
Okay.
Well, maybe I'm going to operate a patient tomorrow. He has COVID and mucormycosis through the nose, and it's
Oh, okay.
starting to advance to the eye, and maybe it's about to enter into the brain.
Okay.
The challenge here that we're having with this patient is to avoid that, to avoid to
Wow.
invade
That's operating in a dangerous area. I mean, for COVID.
Yeah, exactly. I mean, it's COVID for now more than 20 days. Actually, we operate this guy last week with the full mask and Tyvek and everything. We are okay, but we're worried about him because the mucormycosis is being aggressive for him.
Okay.
I'm trying to look for a talk. I mean, I'm going to show you maybe another time, because I wanted to show you this
Yeah,
particular
take your time. No, I'm not in a hurry. Take your time.
and I cannot find it. I don't know where did I put it. I mean, I get gliomas, lymphomas, and when I was at the lab, where did I put it? So how's your day today?
Great. I was up early, like 3 o'clock. I couldn't sleep because I had to get some things together for a meeting I'm going to have with a neurosurgeon from Cornell University, They have they're starting a fantastic online programs in neurosurgery, mostly designed for students in med school that want to go into neurosurgery. Which is, yeah, and also for let me show you, for young residents. And I wrote to him, I said, hey, I'd like to televise what you're doing. You're doing some amazing stuff. I hope to talk to him. And I've televised from Cornell before, which makes it a little easier. Let's see.
I wanted to ask you, how did you come up with this idea of televise?
Well, let me just. What was I going to show you? I get confused sometimes. Sometimes I forget what I'm searching for.
I think that I found it.
Oh, good.
Ah, finally, I think.
Good.
This one talk I wanted to show you, and yeah, I found it. No, I can share my screen.
Yeah, let me, I think I may be on there. Okay, yeah, this would be good practice for you to share the screen.
Yeah, of course, of course. Can you see it?
Yeah. Okay, yeah.
Yeah. This is for a webinar here in Mexico City. We were talking about medial fossa lesions, and I was working, as I tell you, in the hospital here in Mexico City. Well, nearby.
Nice. Beautiful.
Yeah, it's one of the. I think.
Is that UNAM?
I'm sorry.
Looks like UNAM, Universidad Autónoma de México.
No. This is. I mean, looks like because of the murals. I know, but no. This is a hospital. It's like 40 minutes from Mexico City, in the north part.
Oh, okay. Okay.
This is the hospital where I work.
That's your hospital?
Yeah, this is where I'm at now.
Oh, okay. Okay. So is it especially neuro specialty, or is there any area where hospital concentrates, or a general hospital?
This is third level hospital. I mean, we have specialties, but we also, in this hospital, it's works like a general hospital,
Okay. So they have all specialties.
Exactly. That's the idea. We don't have oncology. That's a thing that I don't like. I would like to have oncology in this hospital. Well, maybe it will change with the future, because I mean it's something that I like when I have an oncology case and talk with the oncology colleagues about what we're going to do with that. But with the case, it was a clinical case. It was a female, 41 years old. He has diabetes from 3 years, and it started with an evolution from 2 months with seizures, simple and complex. And he went hemiplegic. Well, hemiparetic actually, not hemiplegic, from the right side, with headaches, not moderate to to mild. They were not that important.
Mhm.
And but the problem with the seizures, she went to a hospital, and this is the CT from the left side, and
Okay.
this was a finding inside the cavernous sinus, a lesion, as you can see, in involving the whole cavernous sinus, the both carotids in both sides. This is a video from the sagittal plane where you can see it. It was not that impressive, the invasion on the supratensoral space and the suprachiasmatic spaces, but it was enough uh, room, you know.
Now, do ENT doctors do a lot of endoscopic surgery down in Mexico?
Actually, yes. My partner here where I work, it's ENT doctor, and we do endoscopic approaches.
All right.
It's a very more common practice right now. I mean, the for a few years ago, I can tell you that most of the lesions inside the cella were approached through the nose, yes, but using the microscope. And now this is a practice that it's been abandoned. It's not being used anymore.
Yeah.
You know, this is the MRI where you can see the extent of the lesion, mostly inside the cavernous sinus. This is why we decided to do a surgical approach to the cavernous sinus, thinking that this was a meningioma more than anything else. So we prepared the patient for surgery. This was made in July, I think, 2020. No, 2019.
Yeah, I'm not a neurosurgeon, but you can approach this from going to the cranium also, this tumor?
Exactly.
Okay.
I
And
mean,
you think it's advantageous to go through the nose?
it was a bit. There was two options. I mean, that's why I put this thing on the webinar to discuss exactly the routes that we can use in this case. One way, one route was the endoscopic approach, but I consider that on my experience, I needed to do it, extracranially to reach the cavernous sinus, to remove the whole lesions through the lateral wall and entering to triangles inside the cavernous sinus. That's what we did in this case. The first picture, I mean, we put the patient, with the whole monitoring, electro monitoring that the physiologists do, and we started doing, the craniotomy. It was a big craniotomy, and this is the steps, during the surgery. We drilled the I forgot the word, the ridge, the sphenoid ridge. That's what we're drilling here, lateral to the orbit, in order to get into the lateral wall of the cavernous sinus. That's what we're doing here. We remove a little bit of the lateral wall of the orbit and the roof. And here we're accessing what you see there is the lateral wall of the cavernous sinus. We're doing a peeling. We're entering inside the cavernous sinus through the triangles. There you can see under the fourth nerve. And there you can see part of the triangles of the cavernous sinus is the third nerve, the fourth nerve, the B1, B2, B3. This is what you see during surgery. The clinoidal triangle is where I'm working on that side.
Is there a big demand for neurosurgeons to learn endoscopy in the Spanish world, in Latin America?
I think so. I mean, there is no uh, clues. I mean, there is. Mm, yeah, the endoscopic.
Is it popular in Mexico, or is it getting more popular?
Yeah, it's popular. It's becoming popular, but there is no a lot of places where you can do it. That's why a lot of patients went under trichinotomies on, but you should operate on these cases through the nose, endoscopically. Now
Okay.
it's changing. More and more places, not just in Mexico City, also in Guadalajara and Monterrey and the big cities, I'm starting to do it endoscopically, these cases.
Well, you can do a series on if you want to, because in India there's a gentleman that's a big endoscopist that trained with Charlie Teo. I guess he's a big endoscopist in Australia. Have you heard of him, Charles Teo? Uh, let me see, let me look him up. You probably
I haven't
recognize
heard.
his
This
name.
is the final steps of the surgery. This is the patient. We were working through the cavernous sinus, moving the nerves that are involved with the oculomotor movements, the third nerve, the fourth nerve, the sixth nerve. She improved immediately after surgery for the movements.
Oh, okay. And this was all done through the endoscope, neuroendoscope.
No. This went this particular case through the head. I'm
Oh,
gonna
okay.
show you another case that I did. This is the post-op CT scan. It was a long surgery, but there was no tumor, as you can see. You can see the changes of the craniotomy, but there was all clean.
Mm-hmm.
The patients, few months later. So I was telling that this case, I wanted to point it out that not always is easy to take a road. I mean, neurosurgery, and orthopedics, and any specialty. I mean, you can do it the same thing to treat the same disease in different ways.
Mm-hmm.
There is no absolute true about what you need to do. But the reality is that you need to do what's safer for the patient in your own hands, I think.
Okay.
Because,
Okay.
I mean, you're not training on endoscopic approaches, on school-based approaches, and you try to do it, you ended up hurting the patient, and you need to take the safe route. This was I'm trying to point it out with this slide.
Well,
So you,
now is the time to educate because people are on the computer more than
yeah,
before.
no,
And
I
that's going
mean,
to last probably for 6 months to a year. I think it's going to not go back to normal, but I mean, semi-normal.
and this is another case that I'm trying to publish. Actually, this is
Really? Okay, let's do it. Why don't you present that this Sunday?
this is an
Uh,
encephalocele that I did it endoscopically.
okay.
I'm trying to because actually I was watching a webinar here in Mexico City, a similar case, and they were all telling, no, you need to do it this transcranially because you can see the defect on the skull base in the middle fossa. But I think that if you can save the patient a surgery through the skull, it's fantastic. I did this
Well,
endoscopically.
Moises, this is exactly why this platform is great. It allows you to get out there and to present your point of view without the big conference thing and arranging things a year ahead of time. You can get to do it in 1 week, less than a week, a couple of days. That's why I love the platform. It's going to improve neurosurgery education. Exactly for the reasons you're talking about. You have an idea and you think it's valid and you want the neurosurgery community to hear it now, not next month, not next year.
Yeah.
So why don't you do it? You want to do it Sunday?
If you want me to.
Yeah, just like you're doing now. I mean, nothing more complicated, just like we did now. And let me know the title. And I'll make a banner. The first step for me is to make a banner, and I make a banner with an artist from Thailand. She's a neurosurgeon. She's excellent. She'll make a nice banner, and we'll think of the best way to market it, and I'll send you that today, and we'll set a time. Let's see, what time is good for you? Is nighttime okay for you? Like 5, 6 o'clock Mexico time? Is that okay? On Sunday?
Sunday. Do you want it to do it on the afternoon?
That's whatever is good for you.
I can work at any time, like from 10 a.m. Oh, I see. This Sunday I cannot do that because I get a surgery.
Oh, okay.
We can do it the next Sunday. The next Sunday, I don't have surgeries.
Yeah. Okay, no problem. We'll do it then.
I got a patient. I need to do it an endoscopic approach actually for a pituitary adenoma.
Okay.
But
just let me know. Just let me know and just say, yeah, we'll be free. Let's set it up.
You want me to give the lecture in Spanish or English?
I like Spanish because I have a lot of English. I like Spanish because I really want to get the Spanish community going.
Of course, I can do that.
Yeah.
This was a rare case of the Stenberg channel, persistence of a Stenberg channel with the encephalocele and CSF fistula.
Okay.
3D endoscopically. I mean, we need to shrink it, I know, but basically is what I've done in this case. I mean, treat a case that most people will think that you need to treat it transcranially.
Yeah.
Because it's not that easy to reach that place. You need to drill a little bit more that you used to, and you can face a lot of times with the recurrence of the CSF fistula. But the patient now is really happy. She doesn't have any CSF fistula. We don't need to operate transcranially, and that's what I like about this case.
Yeah, good. Okay, yeah, just let me know during the week. As far as the translation, just let me know when you can get a hold of another laptop today, tomorrow, whenever.
Yeah, I need.
And I have a couple of people, so we'll see who was going to translate on the 15th. So I would really like to get, other just for other webcasts, I'll ask someone like Arturo, okay, who do you want to hear in Spanish that you'd like to see, but you don't understand? Do you know what I mean? What person in the world, because we can get pretty well anybody, what neurosurgeon do you want to hear in Spanish that that you just like to hear about, hear from? So,
of course.
But yeah, see if you can get a laptop and just let me know. And thanks for setting up. Thanks for, but I think this has potential because of that app. It'll make it easy to access. And I think it'll definitely get my project more credibility amongst the neurosurgery community. Like the
Yep.
people I'm talking to at Cornell now, I say to them, I telecast a conference for them, and then let me show you the conference they don't even know I did it for them last year. It was funny.
How'd you get interested on neurosurgery?
Oh yeah, I never answered that question. I do want to address that because it's certainly relevant to. Let me just show you this real quick. It's okay. Oh. Hold on. Okay, I'm going to share this, and I'm going to say something outlandish, which you may think I'm crazy. Okay. Okay, this is a conference we televised from Cornell in New York. I mean, MIS endoscopy, robotics. Very interesting. Maybe you would have been interested in this. But we had, normally when someone televises a conference, they just give you one long video. But what we're doing is we're dividing them up into every single talk, which is 10, 15 minutes. But
I like, I like that concept because.
Yeah, because you love it. You have your own video to take home.
Of course. I mean, and the duration, I mean, it's important. You need to be able to give your concept in 10 or 15 minutes. I mean, 2 hours, it's.
Yeah, that's what they did. So I was able to go back to Cornell and say, hey, last year I televised a conference from your place, and here we go. We made more than, we divided them up, 41 different presentations.
Wow.
And we edited them and put the intro. Let me show you what a typical one looks like.
And we continue now. We take the focus a little bit more on the
and the presenter appreciates it because now they have a video in their resume, the resume of talks they've given in different places. I think that'll further entrench us into the neurosurgeons liking what we're doing, and I hope it continues. But
I think it's fantastic.
Yeah, I love it, and I think you're going to love it too. And exactly for the reasons you talk about. You have a concept, you want to expose it to the neurosurgery community. You want to invite discussion. You may want to invite some ENT people, et cetera, et cetera. It has potential. If you really feel strongly about an idea, IPE is constantly doing webinars on cystoernoscopy. He's a big believer in it, and he does it ever since I've known him. He's been doing them, yeah, he's very influential. It's very influential.
Endoscopy. I mean, I do love it. I mean, to do it endoscopically, third ventricular endoscopy, cystoernostomy, I do love it.
Are you going to specialize in that, or is that your main like in neurosurgery?
What? I'm sorry?
Is that do you like it a lot? Is that why you do it? That area, endoscopy, nasal endoscopy?
Oh, I see. I was about to tell you that. I mean, I do a lot of pituitary adenomas through the nose. I mean, I do surgeries through the skull because I went to Little Rock to learn skull-based approaches with Dr. Krish. And I do also vascular surgery. I mean, not I not operate as many aneurysms as I would like to, but I also operate aneurysms. I think that I have a video here, but I'm not. I don't have
Juha's
that.
the big aneurysm guy, right?
I'm sorry.
Juha is a big aneurysm guy.
Oh, of course. I mean, it's
He's a king, huh?
it's the king of that, you know. I mean, maybe I have this video here when I was trying and here at the hospital where I work, it's you're able to do this kind of surgeries. Where did I put that? This is just a photo. Well, but I think it's fantastic what you've done with.
I love it. I love it. You know, I was ready to finish with medicine, but this has revitalized me.
Let me share my screen.
And then I'll tell you the story of why neurosurgery. I got into it.
Of course.
Yeah, but show me first what you want to show.
Oh, come on! At the same time, we can do that.
There you go. It's okay.
Yeah.
What is this? What is this case?
This is a surgery from aneurysm.
Oh, okay.
This was a lady like. Let me remember the age. She has 70 years old, around that age, and she had stroke, you know, subarachnoid stroke, and on the CT scan I found aneurysms from the choroidal segment of the internal carotid artery from the right side, if I remember correctly, and. This is the video from the surgery. So as you can see, I do like skull base and vascular surgery. And skull base, I not just do it through the skull, through the cranium, but also endoscopically.
Okay.
But
okay.
I know that I'm a junior surgeon, even that I have this area for.
Oh, okay. So it's kind of area you like.
Yeah, exactly. I mean, I just have 8-9 years been working on
okay. Well, just a quick story why I picked neurosurgery. Because I just was fortunate to run into Ip Cherian. He's an Indian neurosurgeon that's very tech savvy, and I started doing him in neurosurgery. And cystostomy, and then it just went from there. And there have been other specialties that I've approached, but none have been as interested in this as neurosurgeons have. That's my experience. I don't know if it'd be other people's experience. And I decided, and I have a website that's in beta that I just don't have the manpower to do it now. With all specialties, not just neurosurgery.
Oh, I see.
Yeah, I'm just going to bump you off the screen there. Okay.
Of course.
Okay, this is internetmedicine.com, and it's got studios in all of areas of medicine, like neonatology.
Wow.
We have a studio for that, but you know, I just don't have the time to do more than I saw that when I starting to do this project, just too much. I need to concentrate in one area. So that's why I picked neurosurgery. I see. I'm not a neurosurgeon. I trained a little bit in orthopedics, but didn't finish. So I'm just a general doctor with an interest in televising, and I'm televising with neurosurgery. I hope to do all of them, but first neurosurgery. And you know what? I'm going to tell you something. Neurosurgery is the most advanced in the world in Zoom, because I think of what Ip and I have done. If you look at cardiology, dermatology, and you try to find Zoom channels, you're not going to find much, because I've been searching for them. So
Oh.
neurosurgery is out there. They got a head start. And because I think once we get into doing the virtual reality, augmented reality and stuff, if you just have a community of neurosurgeons at Neurosurgical TV, those sciences will be integrated into neurosurgery easier if everyone's already connected. And we could add augmented reality. We could train in that. We could train in this, of course, without neurosurgeons having to go. They go into the online to learn these sciences and try to incorporate them into neurosurgery and improve neurosurgery through a platform that everyone can use. So anyways, okay, the priority of things, just get me the title and the time. The time is 5 o'clock. What time did you want on Sunday?
I can do it at, let me think. The thing is I work at night, on Saturday night, so it would be good for me if we can do it during the day after 10 a.m.
Okay, 10 a.m. is fine with me. Mexico
Because-
time, right?
Exactly. I mean, what time?
Okay, 10 o'clock a.m. is fine.
Miami?
It's 1 hour later. It'd be 11 o'clock at Miami.
It's 11 o'clock there where you are?
Yeah, it's 1 hour. Well, 1 hour ahead. Well, it's 10:06 now.
10:06. Let me see.
It doesn't matter my time. It's your time that really matters.
Okay. Oof, perfect.
Okay,
Here is-
give me the title. Give me the title and a little link to your profile, and that's it. And I'll make the banner, and then later you can get the laptop, and we'll test the televising for translating.
Yeah, of course. Let me try to let me put.
You don't need to visualize the optic nerve and the whole aneurysm. You just go around the neck. As I said, you can put the clips. You can.
I'm
resect
watching.
aneurysm
I'm
and-
watching
and this
the
is
link you gave me
one
from
Oh,
Binko
okay.
Dolan's lecture.
before and after.
Whose lecture? Oh,
Sorry?
Krish lecture?
No, Binko Dolan's lecture.
Oh, okay. Well, listen, boys, I gotta get going. I have a meeting, but okay, send me that info.
Okay,
It was a
please.
pleasure
Yes.
meeting you. Okay,
Nice to
we'll
meet
see you
you.
later. Keep in touch, okay?
Of course.